I thought I'd bring the primary care perspective. I'm a practicing GP in North Bristol, as well as leading the primary care infection group at the university. And essentially what I wanted to bring to our attention was the variability that infectious disease in the community in primary care brings to the NHS and the challenges that result. So there's a roughly 8-fold average difference between the peak infection rate in usually the winter months for respiratory infections and the trough in the winter, in the summer, I should say. And this presents an enormous challenge to health services and delivery managers. I remember as a junior doctor thinking somebody must have known that my really, really, really busy 24 hours was coming, and that they could have predicted it, and that they could have deployed more staff to make the care safer. Primary care is responsible for 80% of all antibiotics prescribed in the NHS and in health services internationally. So if we're going to improve AMR as a problem, primary care needs to really rise to the challenge. And some more information about what's currently circulating could and has been proven already to influence clinician decision-making when it comes to treatment. Patients, of course, also bring their own perspectives. They want a diagnosis, but for them, the diagnosis, as much as anything, is about what they're going to do subsequently. So is their child going to be able to go to childcare? Are they going to be able to go on a family day out? And do they need an antibiotic? So information about what's currently circulating could potentially not only help health service planners, but also parents and clinicians make better decisions about what to do with their time and where to go. For example, if you know that there's flu circulating, you might choose to do something that's less sociable for your day out with your family. You might choose to go for a lonely walk on the hills rather than go swimming. This is the sort of typical graph that you'll see for pretty much any respiratory infection, be it on a ward in the hospital, be it the clinic activity in primary care, or be it community surveillance. And the point here really is that you can sort of see patterns, right? The key thing is at what point can you predict, a little bit like Henry was saying with COPD, at what point can you predict that this is actually going to become a meaningful outbreak of clinical importance, that we might then want to change our decision making? And I'm no better than the average layperson in terms of my AI knowledge, but what I can see is that these are hugely complex data, for which I suspect AI would be very well suited. One can consider, for example, a range of data sources for where this information could come from. It could come from people's handheld devices in terms of what they're doing. Are they changing their activities? Are they not going to work? Are they not going to school? Are they not engaging in the activities that they were planning to do? The data could come from health services. So the health services already record consultations and requests for NHS consultations. Of course, secondary care knows exactly what's happening in terms of hospital admissions for infections. Some of that may be simply syndromic data. In other words, it's what your GP or your current hospital doctor tells you you have, which is pretty poor, frankly. I'm a bit ashamed of, as a GP, what I say to my patients. It's a cold, it's flu, it's a viral illness. But nonetheless, we've got those syndromic descriptors. The more we use microbiology, and it's coming more and more in the secondary care sphere, but it's also coming more and more in the primary care sphere, the more we'll have more information about the actual microbes that are circulating at any given time. So there'll be plenty of opportunities to pull these together and start to use them to influence health service planning and then patient behaviour and potentially clinician behaviour as well. Like the others, I'd be delighted to talk to anyone who wants to talk further. I can bring a perspective about what the problems are, what the challenges are, and what I think some of the solutions could be. Thank you.